Welcome back. You cannot go a day without hearing something about the COVID-19 pandemic. But there is another pandemic in this country that no one seems to mention. We're talking about diabetes. And our next guest says the rate of diabetes-related amputations in St. Louis is on the rise. Yikes. Dr. Goke Akinwande, who goes by Dr. A, created the Midwest Institute for Non-Surgical Therapy, and he's treating diabetes patients without having to resort to these drastic procedures. Doctor, it is great to see you. Tell me about diabetes here in St. Louis. What is the real problem that we face?
Thank you. Thank you for inviting me back. Always a pleasure. Obviously, the issue with diabetes is that the rates keep going up in Missouri and in St. Louis. It goes hand in hand with the rates of obesity. And what you see is you start to see more and more complications over time, and some of these patients come in with pain in their legs, they have neuropathy, they have numbness, and worst of all, they have wounds that don't heal. These wounds get infected, and then if they go to the hospital, sometimes they get amputations. And so this is a major problem. Patients that have amputations, about 50% die in 5 years. So it's something we need to really curtail.
That's awful. What is it that's causing these leg wounds that just won't heal?
So diabetes in itself don't cause leg sores. It's actually diabetes is very, very hard on the arteries, and it causes blockages in these arteries. And when you don't have good blood flow, good circulation going down to your foot, basically your tissue dies, and then you start to have sores. And these sores are incredibly hard to heal. They get infected, and then that's what leads to the amputations that you see in diabetic patients.
So how are you able to treat this then without surgery?
The traditional way to treat these were, doctors would do amputations or they would do bypasses, but we're the Institute of Non-Surgical Therapy, so we do everything minimally invasive. We have a procedure called an angiogram where we go in with a tiny little pinhole incision in the groin or in the wrist. We can basically snake our way through, and then we can get to the lesion. We can open it up with a balloon. Sometimes we can even use a laser to shave off the plaque. And we can do all this as an outpatient. Patients go home the same day and they seem to love it. And everything can be accomplished within an hour.
This sounds about 4,000 times more preferable than an amputation. That's my rough scientific estimate. Wow, that's incredible. It could be a game changer for a lot of people. Dr. A, thank you so much. We appreciate it. I want to let everybody know that the Good Doctor is offering virtual consultations right now. So here's how you can get in touch with them. The Midwest Institute for Non-Surgical Therapy has 2 locations. They're on your screen right now. Call 314-255-2204 or go online to mintstl.com. That's MINTSTL.com.